Okay, have you ever actually stopped to think about the one part of your body that's pretty much always on the move? I mean, while you're talking, eating, yawning, you name it, there's this pair of joints working tirelessly, completely under the radar. Well, today, we're giving this unsung hero the spotlight it really deserves.
So let me ask you, what do you think it is? Your knee? Maybe your wrist? Nope, it's actually the temporomandibular joint, or as most of us know it, the TMJ. That's the incredibly complex bit of machinery connecting your jaw to your skull, and yeah, it's one of the most frequently used joints in your entire body.
And here's the thing, when this hard-working joint runs into trouble, it is not a rare problem. We're talking about an estimated 10 to 15% of adults being affected by what are known as temporomandibular disorders, or TMDs. That means there's a pretty good chance that you or someone you know has felt that little click or that nagging ache. And that's exactly why understanding your jaw is so important.
So, let's kick things off by looking at why this joint is so vital and, what it actually feels like when things start to go wrong. According to the research, there are three classic signs that your TMJ might be sending out a bit of an SOS. First up, there's orofacial pain. That's that deep ache you might feel in your face, jaw, your temple, or even right in front of your ear. Then you might notice your jaw motion is restricted, like it's suddenly hard to open your mouth wide. And finally, there's that sound. You know the one, that unmistakable joint noise, the clicks, the pops, or even a grinding sound.
Now, to really get what's behind those symptoms, we've got to pop the hood and take a look at the anatomy of this incredible joint. Let's see what makes it tick, shall we?
You see, the TMJ isn't just some simple hinge. It's technically a synovial joint, which just means it's lubricated to keep things moving smoothly. But it's also both a condylar and a hinge-type joint. Now, that's a fancy way of saying it is built for a massive range of complex movements. We're talking gliding, rotating, and everything in between. It's way more sophisticated than most other joints in your body.
Okay, so at the heart of the TMJ, you've got three key players. First, there's the condyle. That's the rounded end of your jawbone. It sits inside the fossa, which is basically a little socket in your skull. But the real star of our story today is the articular disc. Just think of it as a small, movable cushion that sits right between them, making sure everything glides along smoothly. Now, this little disc is so important that it actually divides the joint into two separate compartments, and each one has a totally different job. The lower cavity, that one acts like a simple hinge. It's responsible for rotation. That's the very first part of opening your mouth. But the upper cavity, that's all about gliding, or what's called translation. It's kind of like sliding a drawer open and shut. It lets your whole jaw move forward and back.
And this brings us to the really unique movement of the jaw. It's not one simple action, but this beautifully coordinated two-step dance between rotating and gliding.
So when you start to open your mouth, it's not one single motion. First, there's this subtle rotation in that lower joint space, just a pure hinge movement. But to really open wide, for a big yawn or a bite of an apple, you need phase two, translation. This is where the condyle and that little disc cushion glide forward together in this perfectly synchronized move. It's this combination that gives your jaw its incredible range of motion.
So, what happens when that perfectly coordinated dance gets disrupted? Well, that's when we start to hear those clicks and pops, and sometimes even experience a jaw that seems to lock up.
This is the million-dollar question, right? That clicking sound can be really unsettling, but a lot of the time, it's a mechanical issue. A tiny bit of drama unfolding inside your jaw, and it usually has to do with that all-important articular disc we were just talking about.
Okay, a single click. This often happens when that little disc cushion gets a bit stuck or bunched up. As you open your mouth, the condyle has to kind of abruptly hop over that bunched up part to get back into its normal spot. That pop you hear? That's the sound of the cushion snapping back into place.
Now, a reciprocal click is a little more complex. It's basically a sign that the disc is already a bit out of place to begin with. You get one click on opening as the condyle slips over the back edge of the disc, kind of recapturing it. Then you hear a second, usually quieter, click on closing as the condyle slips back off the disc again. It's a two-part story.
And this whole issue often progresses in stages. In stage 1, the disc is just a tiny bit out of place, so you might get an inconsistent click now and then, probably with little to no pain. By stage 2, it's moved further forward, and that's when you get that classic reciprocal click we just talked about. This is often when the pain really starts to ramp up. Now, in stage 3, things get tricky. The click might disappear completely because the disc is so far forward that it's not being recaptured anymore. And this can be the most painful stage. Finally, in stage 4, the disc is permanently out of place.
The clicking and the worst of the pain might go away, but you're left with a jaw that just won't open all the way.
And this leads us to that scary moment of a locked jaw, or a closed lock. What's happening here is that displaced disc is essentially acting as a roadblock. It physically prevents the condyle from gliding forward. That's why a locked jaw limits how far you can open, usually to about 25 millimeters, which is just enough for that first rotation phase, but no gliding, no translation.
You know, understanding all these signs and symptoms is kind of like putting together the pieces of a puzzle. It really helps you become more aware of what your body might be trying to tell you.
So, to solve your own jaw puzzle, you can actually start by asking yourself some of the same questions a doctor would. Just think about it for a second. Is your pain in one specific spot? Does it hurt more when you're opening your mouth or when you're biting down? And what about your habits? Little things like clenching your jaw, biting your nails, or even grinding your teeth at night. That's called bruxism. All of those things place a ton of extra stress on these joints.
Ultimately, it all comes back to those three key features we started with. As the source material sums it up so well, orofacial pain, restricted jaw motion, and joint noise are the fundamental signs of a temporomandibular disorder. They really are the main clues that this incredibly hard-working joint might need a little attention.
So the next time you eat, talk, or even just yawn, maybe take a second to notice this incredible joint. Pay a little attention to the subtle signals it might be sending your way. After all, isn't it worth listening to the hardest working joint in your body?